welcome back to Little Growing Bones. Today we'll be talking about amniotic band syndrome. So what is amniotic band syndrome? Amniotic band syndrome, or also known as stratus dysplasia, is a rare condition that happens before birth. So it occurs when thin strands from the inner lining of the amniotic sac, that is the protective bubble that surrounds the baby in the womb, breaks off, and so these strands break off and they float freely around. These strands can wrap around a baby's body part, any part of the body, especially the arms, the legs, fingers, toes, and act like tight bands around those areas. What happens when these bands form? When these bands wrap around a baby's limb or the diggets, they can interfere with the normal development. Depending on how tight the bands are and where they form during the pregnancy, they can cause a few things. One of those is shallow grooves or indentations in the skin. They can lead to swelling or constrictions around the affected part, around the area that they're wrapped around. They can lead to underdevelopment or missing fingers or toes. And in the more severe cases, they can lead to even amputations. They can lead to amputations of all or part of the limb before birth. Here's something important. Amniotic band syndrome is not genetic. It's not caused by anything the mother did or didn't do during the pregnancy. It's considered a random event during the pregnancy. What are the symptoms of amniotic band syndrome? The symptoms can vary widely from mild to very severe depending on where the bands formed and how tightly they affected the body part. Some children may have narrow ring-like scars on the limb. Others may have fingers or toe that can be fused or missing. In other cases, the arms or legs are shorter or thinner than they usually are. There could be restricted blood flow or swelling of the affected area. In more complex cases, amniotic bands may also affect the face or internal organs, but this is quite rare. How do we diagnose amniotic band syndrome? Sometimes amniotic band syndrome can be seen during a routine pregnancy ultrasound, especially if there are visible limb differences. But often it is diagnosed at birth based on how the baby's limbs look. Typically, the doctors will do a physical examination to assess the band and the affected limb. X-rays can sometimes be done to assess the bones. In other cases, an ultrasound or Doppler studies are done to check the blood flow of that affected limb. Sometimes further investigations are needed to rule out any other conditions. Are there any other conditions associated with amniotic band syndrome? In most cases, amniotic band syndrome is isolated, meaning it only affects that area where the band is formed, and there is no other health issues. However, in a small number of cases, it may occur with other birth differences. For example, cleft lip and palate. It can occur with abdominal wall defects. Commonly in orthopedics, we see it being associated with conditions like clubfoot deformity and congenital pseudothoracic of the tibia. That's why a thorough examination and sometimes referral to a pediatric orthopedic specialist is helpful to help assess further for these kinds of associated conditions. How do we treat amniotic band syndrome? The treatment depends on the severity and the location of the bands. So in mild cases, if the band is only on the skin and doesn't affect the movement of blood flow, no treatment may be needed, just observing the child as they grow. In the moderately affected cases, if the band causes swelling or limits function, surgery may be needed to release the band and further improve circulation or prevent further damage. What about the severe cases? So in children who are born with missing fingers or amputated limbs or very deep bands, reconstructive surgery or prosthetics may help with function as the child grows. Physical therapy, occupational therapy are often needed to help the child learn how to adapt, strengthen muscles, and gain confidence in using their hands and feet. What's the prognosis of amniotic band syndrome? Here's the uplifting part. Most children with amniotic band syndrome grow up to live full active lives. With the right care, therapy, and sometimes surgery, they can do everything from drawing, writing, playing sports, climbing, and really thriving. So remember, the emotional support from the parents, the caregivers, and the community at large makes a world of a difference for these children. So children are incredibly adaptable and resilient, so please don't undermine because they have this condition present. So a quick recap on amniotic band syndrome. Amniotic band syndrome is a rare condition where strands in the womb affect the limb development or any body part. It is not inherited, and it's not caused by anything the parent did or didn't do during the pregnancy. Symptoms can range from mild skin rings to missing digits or even limbs. The treatment may include monitoring, surgery, and therapy. And most importantly, with the right care, children can thrive. If your child has amniotic band syndrome, know that you are not alone. There is help, there is hope, and there's a whole community of parents and professionals ready to walk this journey with you. If you found this video helpful, give it a thumbs up or share it with someone who might need it. And until next time, keep it on little growing bones.